We need to look at what the goal is with medication. And the goal of medication is not to totally get rid of ADHD symptoms. What we're aiming for, let's say on a scale of 1 to 10, 10 being really severe ADHD symptoms, let's say your kid's at an 8, we're trying to get them to like a 5 or a 4. We're not trying to get them down to a 0. So might need to change your view of what happens when kids take medication. If medication is working effectively, your kid should still have the same personality, but they're able to read through something once, or they're able to have the split seconds to think ahead, but they should still have their same sense of humor and personality. Now, if you find that they have what's called flattened affect, that means that your kid seems like they don't want to socialize and they're very kind of quiet and they don't want to be interrupted with their work. That's something also that might be a medication issue that you need to talk to your doctor about. If medication doesn't work, again, figure out why it's not working. First, there might be a dosage change that's needed or a medication change. The most effective non-medication treatments for ADHD are exercise, mindfulness meditation, practicing good sleep habits, and cognitive behavioral therapy are four of the things that are helpful as far as non-medication treatments. They still aren't as effective as stimulant medication, but it's something that you can add to your child's treatment plan whether or not they're on medication. So there are other things that you can work on. There's always layers to ADHD, so the more you can peel back the layers of the onion, the more you get to the root of what you really need to treat.